and I love it. I wish I could speak in both languages, but I didn't remember everything in my 4 years of Spanish. But my name is Gina McKinney, and I'm happy to be here. I'm happy to be in partnership with my classmate and my soror, Dr. Janelle Hall. I'm a native of the city, born and raised. Parents, my father was born in Aspen Place. My mother migrated up here at 11 years old. But when I come back here, and when I come here, what I feel is a village. And that's what my ministry is. I was born in a village. I knew what it was like to have the support of my elders and my grandparents and my aunts, my uncles. My grandmother was a real grandmother. She was in her 50s by the time I was born. My great-grandmother, now things have changed. Grandma is 45, great-grandma is 30. And at 30 and 45, you don't know what you're doing. And you don't have the wisdom to really lead your family. And so what Miss Francine was just talking about is real. My grandparents didn't have much of nothing. My grandfather came from Saluda, South Carolina. He died February 21st, just the other day, made, I think, his 33rd anniversary of his death. But they left with their affairs in order. My grandmother died 3 years after him in 1992. They didn't have much. They left from the projects to the boulevard behind ShopRite. Never had property. But they had their affairs in order. We did not go fun. We did not wreck our brain trying to figure out how to rob Peter to pay Paul. But we also did things based upon our means. And that's what I'm here to do. I'm a minister, but I'm also a licensed insurance agent. So I specialize in life and health. And so I will talk about health in a few minutes. But I'm a representative of Lincoln Heritage Funeral Advantage. I'm a final expense specialist. What Ms. Francine has talked about is real. I'm here to partner. Now, one of the things she did it by herself. That's what I have a problem with. You're not to do this on your own. I don't care who you are, how good you are, and what you do. We all need help in life. Can I get an amen to that? Amen. We all need help. I don't care who you are. We all need help. I'm a single woman. Once the Lord calls my mother and father, that's it. So I'm getting my village in order. I'm getting my affairs in order. Why? Because there's no rhyme or reason of who goes first. No parent wants to bury their child. And at 46, I don't want to be an irresponsible daughter and not have my affairs in order, because it's going to be hard enough for a parent to bury a child. And then to have to figure out how to do it because that child was irresponsible. Because if you don't want to do this, that's what you're doing. We're being irresponsible. There's no other way to say it. And I don't want you to be irresponsible. I don't want you to be by yourself. I'm just here to have a conversation. That's what I'm here for. I don't sell, I educate, and I partner. Because I'm here to sojourn with families. Because we are so used to doing things traditionally, but life has changed. What my grandparents were able to do, I ain't doing all that right now. Because it's a lot more expensive, and I am not who they were. And it's okay if you do something different that your family may not understand, because I'm doing what's within my means. Does that make sense? So I appreciate what may have been done traditionally, but if that doesn't fit where I am, I'm not going to live high on a hog in death because I'm trying to do what everybody else expects me to do. So when I meet with my clients, they're very surprised when I use the word budget, because they're not used to dealing with insurance agents who deal with budgets. But again, I'm not trying to have anybody living high on the hog in death. I have a client now, she's an elder in a church. Both of her sons are pastors, and they're talking about, Ma, you gotta go out in style. What style if I'm already gone? Give me my flowers while I'm here to smell them. You spending all of this money and all of this pomp and circumstance on a loved one who is no longer here to see it, what are you doing? To me, either that's guilt or you trying to show off for people who are in the audience. And plus, we're not honoring our loved ones as they were. So when we don't take the time, as Ms. Wise said, and get our affairs in order, writing down what you want, people are doing for us what they want. I've been to some funerals, and I'm like, honey, this ain't who this person is. But if this is what y'all want to do, and then you spend all this money, and after the cloud separates, money, you broke. And then you realizing all of that money has been put into the ground because you were grieving. So you at Bragg or Madonna saying yes, 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 or Alvarez, Martinez to everything. But when you have things written, you're leaving a roadmap of instruction. So as Miss Francine said, I can't wake back up and say, no, baby, don't go left, go right. But if you have the written instructions, it's a roadmap. Yes. It's a guide. But more importantly, as an agent, I am here to be with the family. I'm here to sojourn. I'm here to be that extra level of support that you are not able to do. And really, I believe that many of us probably have our affairs in order. But I'm probably needing to talk to your children and your grandchildren. Because sometimes we don't want to talk to our parents. Because we don't want to face that reality. And what I say to them, shame on you. Because it's time for you to be a big boy and a big girl. Because if you have children, how are you going to prepare them if you don't learn by example? And so I'm blessed to have been partnered with the United States organization. Being a native of the state, it is my desire to give back to the community that raised me for 18 years and made me the person that I am. I'm blessed to be a part of a local insurance agency. We are located in Garfield, New Jersey, right around the corner from the Walmart. Now, who's gonna sit here and say they don't know where that big old Walmart is? Okay. So we know where that Walmart is, and that Burlington, and that Marshall. You know that. And so I'm located right around the corner from there, and that's a blessing because my father's church is right across the street. And that was a godsend. So when the Lord sent this to me, I didn't need to second guess. I knew what the Lord was calling me to do. And this is my ministry. This is not business. This is us being good stewards over the lives that we have been blessed to live. Because this life is not really about us, but how we can be a blessing to someone else. And so that is what I'm here to do. And for my Spanish natives, like I said, my agency is Spanish. My manager, Naida Rivera, her husband, Gerardo Reyes, are from Puerto Rico. So I do have Hispanic agents who can speak, who can help the family, and I would love to give you all that specific information. But that's what we're here to do, is to just become a part of your village. Allow me to sojourn with you, allow me to have a conversation with you, because that's what this is. It is a conversation. We're gonna plant the seed and we're gonna trust that everything works out as it's supposed to. So what I'm going to do when I finish, I'm gonna walk around. I do have an insert. This just gives some basic information about what I can offer for you. If you're interested, you can fill out your information, and all that does is give me permission to contact you. Okay, I also have some cards with my information. That's getting your house in order. The next thing I want to talk to you about is health insurance. The Get Covered New Jersey. I first got into the insurance game as a Medicare expert. I love working with my seasoned saints, because y'all are not seniors, y'all are just seasoned. I got a whole lot of flavor. So that's how I like to reference you, or you are you're my seasoned saints. And so that's how I got into the game, helping those turning 65. Getting that free government health care, which is real cuckoo for Cocoa Puffs, with all of the changes that they made. So I'm here also in terms of that. I work in Walmart. I normally have my own store, but it is very important that every single year, someone is helping you to check your Medicare. It doesn't make a difference how much you love your plan, how much you love your doctors. The government allows your insurance company to make changes every single year. And if you are not aware of those changes, and once the impact occurs, there's nothing you can do. So you know in October, when you start getting all that phone calls and all that mail and all those commercials, and they're making you real confused, like, oh, what's all this good stuff? Yes. Yeah, that's the annual enrollment period. So that is when I like to check all of my clients' plans. And what does that mean? If someone is trying to help you and they are not first asking you about your prescription drug medication, they're not helping you. They're helping themselves. We have to start with your pharmaceutical drugs. That's what our seasoned saints can't afford. We have no problem going to the doctor. We have no problem going to the hospital. It's the prescription drugs that are expensive. So this is what Ms. McKinney does. If you allow me to meet with you, I'm simply gonna ask you for your medication. And I need the bottle, because we can't make any mistakes on what your medication is, your dosage. We can't play those games. So I get a list of all of your medication. You give me the list of all of your doctors that you desire to keep. All we're gonna do is take a trip to Medicare.gov. Medicare.gov asks for your zip code. We put in 07055, Passaic County. We put in all of your prescriptions. You tell me the pharmacies that you like. We put in those. We press enter. Medicare.gov is going to tell you how your current plan is ranking for the upcoming year. That's all we do to check. Okay, so I give an example. My mother had Clover for years, loved it, till my father had a stroke, and her being his caregiver made her sick. So then she developed rheumatoid arthritis. So now she started taking medication. Once we ran her drugs for 2021, Clover was about $1,300 for the year. Not bad, but United Healthcare said $300 for the year. You do the math. What sounds better, $300 or $1,300? My mama said, I want that $1,000 savings. We're gonna bust a move. So we switched my mom from Clover's Medicare Advantage to United Healthcare. Why? Because of the $1,000 price savings. That's what we're here to do. That's the only way we can help to keep money in you all's pockets, is to make sure that you are not being taken advantage of financially by being in the same plan that you've been in since you first got into Medicare, because nobody came to help you check to make sure that that was still the best plan for you. And again, the medication is what's going to dictate it. However your Medicare plan treats your drugs of choice, that's going to be how it goes. So unfortunately, I have to hurt some feelings sometimes and tell you, you can't be married to your doctor. Don't care how long you've been going to her or her. They change plans based upon their needs. Do they let you know? No, they don't. So you have to do that, and if I talk to people of faith, that's what we step out on. That's why we have a provider directory. Lord, I'm gonna trust you, let's go. But you can't stay with a plan just because you like a doctor and the plan is not in your best interest, if that makes sense. So that is what I am here to do at the beginning of every annual enrollment period, which again begins October 15th and it ends December 7th. But also, is there anybody who might happen to be on Medicaid, which is the free insurance from the state, and you also have Medicare? Is there anyone in here who receives both Medicaid and Medicare? Okay, but this is free information. There are individuals who do receive both benefits. And so if you know of anyone who is receiving Medicaid and Medicare, and they have not combined those benefits, they need to contact UPO and have a conversation, because those benefits can be combined into what's called a dual health plan. And the dual health plans have many more benefits. And so what it means is Medicare is your primary provider, but whatever Medicare doesn't cover, Medicaid comes and takes care of the rest. They have a large over-the-counter allowance. Most of the coverage is $0. The premium costs nothing. You have no co-pays. You pretty much pay nothing, but again, you have to be duly eligible. Those are people who receive Medicaid from the state of New Jersey, as well as Medicare from the federal government, but you are eligible to combine those benefits. And now a lot of over-the-counter allowances have included groceries. So this is a life changer for a lot of families. And so even if it does not pertain to you, we know a lot of young people who are on Medicare because of disability. So Medicare is also eligible not just for those turning 65, but if you've been disabled for 2 years or more, that puts you on Medicare. So there are quite a few people who are under 65 with children who receive Medicare. They may also receive Medicaid. Those are the people I need to reach. This is us working together to be a village, because the federal government is not going to knock on your door telling you, baby, come check out these benefits. No, they're not going to do that. That's why we're here, to make sure that the Black and brown community is aware of all of these benefits. And I didn't start with this, but all of my services are free. Anybody who wants to have an appointment with me, meet with me, my services are 100% free. It doesn't cost anything to have a conversation. If you decide to allow me to bless you because you want coverage that I can provide for you, the insurance company takes care of me. You don't ever have to worry about anything. I'm here at your service as your agent, and that's really what I'm trying to do. We need to stop hiding behind flyers and telephone calls with insurance. Because unless you want to leave a 1-800 number with your family to file a claim, good luck. Because it's heart-wrenching. There's no instruction. They don't know what they're doing. And they don't have the time on the job to be on hold with an insurance company for hours. That's where I come in as an agent. I do the work on their behalf because they trusted me to sit with them and get their families in order. And I want to be here for generations. I want people calling me, you helped my grandmama 15 years ago. Okay, baby, come on down. Let's go. That's what I want. Because I remember the stories of the insurance people knocking on the doors in the projects. That was the only way they got it. Because people had to go to them, and so that's what we're doing. We're coming to the community. So again, get your houses in order. If COVID has not told us anything, time waits for no one. Time waits for no one. And we need to get things done. And for me, it's peaceful. The Lord ain't snatching you just because you're being responsible. No, I don't believe that. And so when I meet with clients, they are emotional at first, but when we're finished, there's a peace. Because this is what being an adult is about. My mom and them didn't tell me that. They just told me don't rush to be grown. They didn't tell me why. Because it's doing the things that you don't want to do.
Yes,
that's what being an adult is. Doing the things that you don't want to do, but it's not about you. And even if you're nervous, even if you're afraid, step out on faith because there's something better on the other side. We don't have to do this by ourselves. Death is natural. We have to stop making it unnatural because anything born to man is going to die. But God first gave, God gave back. He wants it. And so if we don't understand it and we need to get these babies covered, we're having children left and right, but their lives are not covered. They're a precious gift. Children need to be covered. And if you can't afford to cover them, I'm going to ask why you're having them. That's just the name of the game. I don't have children. Because it's called the choice. They're real and they're a lifetime sentence. And I didn't want to sign up for it. And I'm not married. That's just being my truth. They're real. And my parents are still parenting me at 46. So it never ends. It never ends. So yeah, I'm going to bypass that book. We're not going to do that. I got 5 nephews and a great niece. That's about all we're going to do. But again, thank you all so much for the time. And like I said, I'm just going to come around. I'm going